I was very fortunate. Sorry. That thanks to Dr. Phillips, he had caught it very, very early. Mine had not spread.
Yvonne is lucky, but not just because her doctor was vigilant. She takes charge of her own health care with breast self-exams.
I personally had not noticed any changes.
And annual checkups.
And I do my yearly mammograms, and I always keep my appointment.
The routine for that is a screening mammogram, meaning 2 views of both breasts, and that's what we would do for anybody.
Yvonne's mammogram caused her doctor some concern.
Dr. Phillips had compared that mammogram with the previous year's mammogram, and he had noticed some differences that he wanted to make sure that everything was okay and wanted to rule out anything that might be going on.
The American Cancer Society recommends annual mammograms starting at age 40.
In order to attempt to detect cancer at its earliest stage.
The difference with her was that her mammogram showed very, very dense architecture, which makes mammography insensitive. In her particular case, there's just real concern that we might miss something.
That meant another test called breast-specific gamma imaging.
It has about the same radiation dose as a CAT scan, so we don't want to do this on everybody. We need to have a good reason to do it.
You reach the point where you think, this is serious. He wouldn't, I wouldn't be going back over there for this series of tests if it wasn't serious. So in the back of your mind, you know that what they're looking for is probably there.
And it was there. The BSGI showed a clear concentration of cells.
In this right breast, an area we couldn't feel, we didn't see any corresponding abnormality in the mammogram, you clearly have a focus that is different from the rest of the other breast or in the right breast.
The other tool doctors have is an MRI, which emits no radiation.
The MRI is a more sensitive and more specific exam because we can see the anatomy better than we can with the BSGI exam.
Yvonne's tests confirmed what she already suspected.
I got a call from my primary physician that it had come back cancerous, positive for breast cancer. And then it was, we need to schedule you with a surgeon. They give you your options, you have an option of radiation with a lumpectomy, or you have an option of mastectomy. And I have had a history of fibrocystic breast disease and had previous biopsy. So I elected for a bilateral mastectomy.
Even though her surgery went well, recovering from cancer is daunting.
When you have that 6 weeks period of time where you're at home, you're not at work, you can't work, and all you have to do is sit there and think about it.
The bottom line is, breast cancer can be treated successfully, but it all starts at home.
We find patients who have identified their malignancy because they did their own self-exam. Just like for this patient you just saw, there are malignancies there that we may not see with a mammogram, so we need all the help we can get to find them.
I encourage everyone to think about what can I do to be a healthier person. If it's a test I need to go get done, get it over with, do it.